so we do rely on them to provide it to us. We are still waiting on that 2020 data. But in 2019, we had just over 2,000 births in Peoria County. Our crude birth rate was 13 per 1,000 population. The general fertility rate was 55 births per 1,000 women between the ages of 15 to 44. It was lower than the previous years. We had 67.7 births per 1,000. 3/4 of our births were within Peoria City zip codes. First trimester care decrease 1%. So 77% of those women had first trimester care compared to 78% in 2018. And then our inadequate prenatal care remains at 23%. So 7.3% of the births in 2019 were teen births, and with a rate of 30 births per 1,000 teen females. And that is higher than the state and national levels. Our mortality report for 2019, we had just over 1,800 deaths in Peoria County. The age-adjusted death rate was 859.6 per 100,000 population, and the median age was 76.5. The overall age-adjusted death rate for African Americans was 1,547.1 per 100,000 population for males, and 1,085.9 per 100,000 per population for females, compared to 912.4 per 100,000 for white males and 695 per 100,000 for white females. So you can see the big disparity between males and females of color compared to their white counterparts of the same. Our top 5 leading causes of death were cancer, heart disease, respiratory disease, dementia, and then accident and injury. Our STI data from 2019 to 2020, our chlamydia incident rate continues to decrease, while gonorrhea incident rate continues to increase. The rates for both STIs are still greater among our African American residents compared to their white counterparts. And the highest number of cases are occurring in our 03, 04, and 05 zip codes here in Peoria. Rates are highest among ages 15 to 29 for both gonorrhea and chlamydia. And the incident rate for both chlamydia and gonorrhea in Peoria County were 1.4 to 2.8 times that of state and national levels. Our syphilis incident rates were highest among individuals from 20 to 29 years in 19 and 20, whereas in 2018, they were highest among those in their 40s. Syphilis incident rates continue to increase in Peoria County, but even though they're still increasing, they're not increasing at the rate that they once were. We had an 80% increase of cases from 2017 to 18, and then 48% in 2019 to 16% in 2020. So just in those past 3 years, we had an 80% increase down to 16%. So that is good news. Even though it's increasing, it's not increasing as high as a rate as it once was. This is an infographic that we put out. We did start a comprehensive STI rate reduction plan here at our health department, and we've reached out to our community partners and health partners and facilities within the area as well to discuss our rates of chlamydia and gonorrhea in Peoria County and what we can do to reduce that plan. So Part of this comprehensive rate reduction plan, I have 3 disease specialists that work on our communicable disease and reach out to those who have been diagnosed with an STI. We get them into clinic for treatment. We also do contact tracing on them, so we can reach out to their partners if they're uncomfortable, to let them know that they've been exposed, so their partner can come in and get tested and treated as well. We do that anonymously. We are looking at other ways to reach out to people, as sometimes they only know them on Facebook or Snapchat and don't have a number or a last name. So we are looking into those apps where we can reach out and just say, hey, we want to contact you about some health information. Can you please call us at this number? If they don't think their partner would come in, but they're okay talking to their partner, we can do expedited partner therapy, so we can send treatment home for that partner to take if they won't come into, so we can start decreasing the rates of chlamydia and gonorrhea. Another tool that we're encouraging outside partners to use is extragenital testing. So we don't always have STI in our urine, so swabbing the throat and the anus and things like that. So we're catching it that way because it's not always going to show up in the urine, and if it's not there, so they can have it in other ways and spread it that way. And we want to reduce that as well. So we've reached out to our partners as well to start this kind of testing. And then also every time someone comes in for that doctor, if they're coming in for a yearly doctor appointment, have you had any new partners? Do you want to be tested today? And making that part of the norm as well. And doing those testing at each doctor's appointment as well to catch it early. We also have our opioid epidemic. Our overdose deaths in Peoria County in 2019 were 40. So that was 2.2% of our deaths, with a crude death rate of 22.1 per 100,000. That is a decrease from 2017 and 18. A 13% decrease from the previous year. 45% were due to fentanyl intoxication. And then 50 to 100 times more, fentanyl is 50 to 100 times more potent than morphine. Overdoses accounted for 20% of deaths among 61605 residents in 2019, making it the 3rd leading cause death within the that specific zip code and area. And then again, our African American population are more heavily affected than our white counterparts as well, with individuals between the ages 55 to 64. We have an opioid hub. I put the link down here, Opioid Awareness, Peoria County GIS Hub. So this is something that we put out, so it shows how many people are dying each day from opioid overdose, and then how many Narcan administrations that we've done in Peoria County. Our total overdose mortality is 185, and that is between January of 2017 to June of 2021. One thing that we want to do with this is start an app for our community partners that administer Narcan, so it'll be more in real-time data, and we're not getting quarterly reports, that it's updated daily, so it can show more in real time of how many people are overdosing, and then if the Narcan is working and how and administering that. This is if you get on that website, this is part of what you can see. The top are different tabs that you can click on for information and data. And this map just shows our Narcan administration rates. So our data is too new and we don't have enough of it to go on, but what we eventually want to see is, are less people using, or are we administering more Narcan with our ODs? And so that is one thing that we want to see in the long run, is a decrease in opioid use and that Narcan use too. So, you have any questions?
No, not right now.
Okay. So that is my presentation. Do you have any questions just about epidemiology or the health department in general?
I don't think so at this time, but that was like really good look at all the epidemiology things going on in this area. So that was really useful. Thank you.
Great. Okay, well, thank you for your time.
Yeah, thank you so much.
You're welcome. Bye.
Bye.